Hello everyone, I'm Dr. Howie Chen from Joint Shantou International Eye Center. Today's topic is part 3 of ocular examination. We will talk about slit lamp and fundus examinations. When we finish this section, you should master the techniques of slit lamp and direct ophthalmoscope examination. The slit lamp microscope is an essential instrument in ophthalmology. It provides a narrow focal slit beam that produces an optical section of the ocular tissue. It is microscopy which gives a magnified view of the detailed structures. Before we start the exam, the slit lamp microscope should be well set up. First, the power of the eyepiece should be adjusted according to the examiner's refractive error. If the examiner is entropic or wearing glasses, the power should be set at 0. Second, the distance between the eyepiece is adjusted according to the interpupillary distance of the examiner. Third, the height of the table and chair is adjusted so that the patient can be comfortably positioned. Invite the patient to put the chin on the chin rest and the forehead forward to the headrest. Fourth, the height of the chin rest is adjusted by turning the knob on the side of the chin rest so that the patient's eyes are at the same level as the marker. There is a joystick driving the microscope to the left and right, forward and backward. Additionally, rotating the joystick moves the microscope up and down. Therefore, by controlling the joystick, you can move the focus to different structures, usually starting from the eyelid, then conjunctiva, sclera, cornea, anterior chamber, iris, and then the lens. You need to practice and experience of what is normal and what is not. Usually, the right eye is examined first and then the left eye. There are some settings on the slit lamp microscopy. The magnifications can be changed. You can choose a low magnification to get the overall impression or a high magnification to study the detailed structures. The intensity, height, width, angle, and color of the slit beam can also be adjusted. Some patients may be photophobic and the lights need to be dimmed. The height of the slit beam can be used to measure length, such as the diameter of the cornea. A wide beam provides a diffuse illumination, while a slit beam provides an optical section. Different angles can provide different optical sections. The blue color is used for illumination of fluorescent staining, which can highlight the abnormality of cornea epithelium and tear film. Slit lamp microscope is used for anterior segment examination. Several instruments can be used to examine the posterior segment, including direct ophthalmoscope, indirect ophthalmoscope, slit lamp microscope, with non-contact lens and contact lens. The retina can be better seen after mydriasis. The fundus examination through small pupil has a limited view. Direct ophthalmoscope is a small handheld instrument with a light on it. Before the examination, inform the patients that you are going to look at their eyes with a bright light and that you will have to get very close to their faces. When examining the right eye, the examiner should stand on the right side, use the right hand to hold, and the right eye to look into the ophthalmoscope. When examining the patient's left eye, left side, left hand, and left eye should be used. Have the patient look at a distant object. Set the lens power to +8 to +10 diopters. The ophthalmoscope is held at 30 cm from the patient's eye, and the examiner checks for the red reflex and opacities. While reducing the diopter setting, approach the patient more closely and you will see the retina. Indirect ophthalmoscope provides a wide field but inverted image of retina. Tighten the headband and then adjust the slider on the eyepieces to meet the interpupillary distance. Adjust the angle and brightness of the illuminating beam so that it falls in the view of both eyes. A 20 diopter lens is then held at approximately 2 cm in front of the patient's eye. Moving the lens gently backward from the patient's eye should bring the retina into view. Gentle tightening may improve the view and reduce unwanted reflections. The peripheral retina is viewed by asking the patient to look into different directions. It is important that the examiner also move around the patient to obtain the best view of the retina, making sure that the illuminating light enters the eye at the most appropriate angle. A 90 diopter or 78 diopter non-contact lens can be used to carry out indirect ophthalmoscopy using the slit lamp microscope. The slit beam is positioned vertically and centrally in front of the patient's pupil. The lens is held parallel to the cornea plane with the light from the slit lens central in the pupil. The slit beam is manipulated to vary the area of retina being illuminated, and the patient asked to look in the relative direction to view the different area of retina. Retina examination can also be performed with a slit lamp microscope and contact lenses such as a 3-minor lens and a panretinal lens, but the lens have to be put onto the patient's cornea. In this section, we talk about slit lamp microscope, which is used for the anterior segment, and several techniques for fundus examination, including direct and indirect ophthalmoscopes, slit lamp microscope, with non-contact and contact lenses. Thank you, and here are some references for further reading.